Denver receives thousands of 911 calls every year that don't require a police officer. The program that sends a mental health professional and paramedic instead is getting popular. Last year, the STAR team alone could only respond to about 20% of the calls it could have gone to. Thanks for joining us. I'm Kim Christensen.
I'm Tom Green. 9 News reporter Kelly Ranke is with us now, taking a look at some funding that could help the STAR program help more people. Kelly?
Yeah, Kim and Tom, the grant is worth $1.5 million, and city council members will talk about this proposal this week. Every year, STAR is responding to more and more calls, and the program hopes this money will allow the team to expand.
Since 2020, Denver hasn't dispatched police to some 911 calls. Sometimes for a mental health crisis, a different team is more appropriate to help.
And so we know that there's a lot of mental health and substance misuse need in our city.
Lorez Meinhold is with Caring for Denver Foundation, which has helped fund the STAR program. A paramedic and mental health professional are responding to more and more calls every year. Even though they've expanded from 1 van to 13, it's been challenging to answer every single call.
As more and more people know about STAR and this alternative response, more people are looking for that non-police response that gets people connected to the right care at the right time.
To meet demand, Meinhold says the program needs to grow. They've submitted a grant application to get $1.5 million, which will connect people to resources and help hire more clinical staff.
The hope is with more people, more staff, we can reach more people and more staff.
So many calls were deferred to STAR last year that the program alone could only respond to 1 in 5 calls, 20%. It's an improvement since the program launched in 2020.
We've definitely seen an influx of need for crisis response post-COVID.
Wellpower provides the clinicians that work on the vans. They'd like to see the program grow too, so more people can get connected to care like mental health support and housing.
The crisis doesn't end when we so we want to make sure that crisis is minimized so that people are getting that long-term care and support they need.
It's an alternative to a police response. They want more people in Denver to receive.
We recognize we need a public health response, not always a legal response.
A majority of the people STAR connected with last year needed mental health services. Housing and shelter connections were also popular. The grant agreement will be presented to city council members tomorrow.
Yeah, the numbers indicate it's been very successful and still has much room to grow.
Yeah, and when we talk about, the STAR program alone only being able to respond to about 20% last year, that means that other calls are being responded to by police officers and or another agency, which wasn't the intention of this program. So they hope that adding more staff will bring those numbers up.
All right, Kelly, thanks.